Everyone has a story, but not every story was told. Sometimes when you are writing your story of life, you need to correct it with maybe like a pencil and sometimes with a rubber. However, when you are writing a story of your journey, sometimes there could be a physical pain that you need to correct it, but with a physical therapist. And today we're gonna have someone special for that. I am your host, Marzuk Saeed, joined by my dear colleague, Abdullah Hindiani. Hello, Abdullah.
Hello, thank you. Thank you for that lovely introduction. And like you said, yeah, physical health is so important. And that's why today's guest, we have Muhannad Bakir, who's a physical therapist, who's also a chiropractor. And he's going to be talking to us through all of the, issues related to basically the human body, right? The anatomy and how, to deal with pains and everything.
Of course, and some of you unfortunately think that physical therapy is just like a spa or something that you don't need to do very often.
Yeah.
But there's even more to physical therapy. It's related to the way we sit, the way we walk, the way we grab things. It's very important.
Yeah, and honestly, I'm really excited about this episode because chiropractic field, I keep getting that word incorrectly, but that is one of the earliest forms of of medicine. So I'm really curious to see the progression of that field and how in today's world it kind of, works.
Yes, there's a lot of development that happens into that field. We're gonna discover it with Muhannad Bakir, so stay tuned. After this exciting and informative intro, here we have him, Muhannad Bakir, physical therapist. Welcome to the show, Muhannad.
Thank you.
How are you doing today?
Good.
So, Muhannad, before the clinic, before the certification, tell me more about Muhannad, who he was as a kid.
Actually, I grew in Kuwait. My high school was here.
Okay.
My name is Muhannad Bakir. Okay, I studied physical therapy in Cairo University in Egypt for 6 years. And I practiced my profession there also for 2 years. I'm specialized in orthopedic field and sport injury. And I'm also a chiropractor.
Very interesting. Like, what drew you into this kind of field?
Actually, when I was in high school, my favorite subject was biology.
Biology?
Yeah, I always have the highest degrees was in the biology. This is my best subject. Yani.
It was difficult for me.
Yeah.
Even all the time, Abdullah.
Yeah, I'm so far away from science projects, as far away as science. Yeah.
Yeah, so I liked biology so much. Math was not my field at all. Yani. So I said to myself, I'm gonna be a doctor one day, and that's it.
Yeah. So the thing about chiropractic, care and osteopathic. Did I get it right?
Yeah.
Yeah, because I was cheating.
The science is
so much.
called osteopath.
Osteopath.
Yeah.
Yeah. So that particular medical field, what drew you into that? Because the transition from biology to that is going from studying biology then studying anatomy. So what was the decision there?
Actually, when you see the body heals itself,
Yeah.
it's an amazing mechanism. So osteopath depends on how to treat the problem or the injury from the first time with one session.
Oh.
So it's very great.
Yeah.
You don't need 6 sessions or 4 sessions or something like this. No, you need only one session. We do the assessment, we see where's the problem, and we treat it from the first time.
Yeah.
Yeah, maybe in 1 hour we can control the pain like 70%.
And what would you say is the most common factor in all pains within patients? Is it lifestyle choices? Is it like
I think it's from the lifestyle.
Okay.
Especially many people they don't practice their life in a good manner. Their postures and they sit very wrong. They sleep very wrong. Using the cell phone too much. They exhaust their necks, their backs. Yeah, that's it.
Like without having a healthy lifestyle or like sport or going to the gym.
Going to the gym is very great because it will prevent you from the injuries and will prevent you from the other sort. You can take it from your daily life.
Yeah.
For example, many people they don't watch their how they sit in the chair. Most of them they sit in the wrong way. and most of them they sleep also in a wrong way. For example, they sleep in their stomach. This is wrong. This is will increase the pain in your lower back, in your thighs, in your neck. That's it. So when you do like this, it will increase the pain. It will increase the bad posture of your body, and after many years, you're gonna have the injury.
Very interesting perspective. Like a lot of people, when they think about physical therapy, they just think about it as a rehab or something like one-time session.
I wish all the people see it as a rehab. The problem is not here. It's the problem that most of the people seeing the physical therapy is like a spa.
Like,
It's like you are going to do a massage or you're gonna go to use a hot jacuzzi or something.
Swimming.
Yeah. Swimming actually it's part of rehabilitation. It's very great, but they think they are coming and they're coming to do only massage and relieve their body. Yeah, it's not like that. It's a treatment. Yeah, it's a treatment and it's a protection that will change all your life.
Yeah, it's a very important thing because I broke my leg a long time ago, so they had a augmented bone within it and a metal plate.
Yeah.
And then one of the most necessary things that I had to do is go to rehab and physical therapy.
Yeah.
And the doctor even said, like, you don't need medicines as much as you need the physical therapy. That's how much it's more important than anything else.
Exactly. See, after the bone are broken, the muscles get weak. And the inflammation increased in the same area.
Yeah.
So especially if it's a big fracture in your bone, actually you will need a long time for rehabilitation.
Yeah, that's right.
For two things: for reducing the inflammation and for making the muscles more stronger.
Yeah.
And I see this will take. It depends in everyone's situation.
Yeah.
And in that term, since we are talking about like treatments, what are something patients be surprised during the treatment session?
Actually, when the patient come to the clinic.
Okay, I see you smiling.
Yeah, because most of them they think that they gonna get more relieved at the same time, or they gonna be more
like in a quick way.
Yeah. In a quick way in the same session or the same day, but they get surprised when they know that the pain will increase at the same session or the same day.
It will increase.
Yeah, because we use many methods and many techniques. So when you use your physical therapy protocol, it depends on many things. You can use, for example, the dry needles. You can use the manual therapy. It will be heavy. Sometimes we use the blades. Sometimes we use ultrasound. Sometimes we use shockwave.
Depends on the case.
Yeah, for sure. So when you use all of this, especially if you are osteopath, so the osteopath is using many techniques at the same time.
After saying this, now it comes to me like a psychopath.
So that's true. Most people they see that you are make the pain worse. So when you tell him that the pain will increase at the same day, he got shocked. Like, what? How it will be increased? I came to you because I want you to treat me, not to make the pain increase. So when they know this, they like, what? How that will happen? Because it's up and down. So when we do the session, it will go up for the pain, but it will need 1 day, 2 days, maximum 3 days, and the pain will decrease a lot.
Like severely.
Yeah, a lot.
Okay.
But some of the patient, not all of them, at the same time, during the session, he feel much better and more relieved.
Alhamdulillah.
It depends on the case.
Because there are
eventually
pressure points and stuff, right?
Trigger points. We call it trigger points.
Yeah.
Trigger points actually, it's like we call it fibrosis. It's like small notches inside the muscles. So when you have this notches inside your muscles, you feel pain, or it make the muscle not contract in a good manner.
Oh, okay.
Yeah.
So then you release it, and that's where the pain goes away.
Yeah, we release it, or we use the most effective thing for the notches or for the trigger points is the dry needles.
Oh, okay.
Yeah, the dry needles is, for me, it's like a magic.
Like a magic.
Yeah, so many people get terrified from the dry needles, but I'm saying it's like nothing.
Something easy.
Yeah, because when he see the results, he will know that the dry needles is the best.
The best option.
Oh,
and right now, like I'm imagining the patients coming to you, like sitting in the clinic, and in the room, they are scared, they're frustrated. What are some techniques that you use to build trust with them and make them feel like relief?
Actually, not all of them are frustrated, but the most people, part of them that are frustrated, that when they come with a lot of pain, and when they have facing the pain for a long time. Yeah, for a long time. So in this case, you don't have to do anything just to ensure the patient that will be good and relax. And it's a process that it will take time, and everything heals with time.
Yeah.
Yeah.
And you mentioned so many techniques involved in physical therapy and chiropractic. And I want to ask about something in particular. When a patient come to you and they're asking about, I have pain and this and that, because this field has so many techniques, has so many science behind it. How do you choose, to trust what the books say or what your hands and experience says?
Actually, we always depend on the textbook.
Okay.
Okay. But in some cases, you depend on your experience.
Yeah.
Yani you are seeing the thing from your own vision. So sometimes, we rely on the textbook, we rely on our science, our education, everything. But sometimes the patient, he doesn't need the textbook or or the science that you learned. He need the experience that you are seeing from the previous patient. So some of the cases we are using our vision.
Oh yeah.
Yani maybe someone or the science maybe say it's contraindication, it's wrong, you can't do this. But in my point of view, I used before with other patient, and it helped him a lot. So sometimes we are using our experience.
Yes, very impressive. And regarding experience and also regarding different customers or patients that you are involved with, some of them I know they come and some of them maybe could change you like in an emotional way or professional way.
Yeah.
Was there like a case that you can remember?
A lot of them.
A lot of them.
Yeah. One of the cases that changed me or changed my life, he's an old man, he's in the 60s. He came to me with a very difficult problem. When he prays or when he raises his hand, he gets shaken a lot. He have shaking in both of hands. He got to a lot of doctors and a lot of examination and other things. No one know what's happening with him.
Is that regarding to like a rasha that we say in Arabic?
Yeah.
Same.
It's like we call it like a shivering.
Shivering.
Yeah. So I told him we're gonna do our examination, we're gonna do our assessment, and we're gonna see what's the problem. At the first, I didn't believe him. Like how it's happening. Yani, this is the first case I have like this, So when he did the movement with me, like raising his hand, and he can't pray. He can't even pray.
He cannot even like allow it to
he can't raise his hand like this.
Wow.
It was when he raised his hand like this, it was like shaking a lot. So I done the assessment. Can you imagine the problem was from the neck?
From the neck?
From the neck that affected the hands?
Yeah.
Oh.
Because the nerves that innervate the both of hands, it's come from the
neck.
cervicals. Yeah, from the neck. So he had a lot of compression between the C3, C4, C5, C6, most of all the vertebrae in the cervicals. Yeah.
Okay.
They are compressed and they are compressing the nerves that innervate the both of hands.
Affecting them negatively.
Yeah. Because when the nerve is compressed, it can work effectively. So we did the decompression, we did the manual therapy, we released all the muscles for the neck, for the shoulder, for the forearm, for the hands, for the fingers. I want to tell you that after the second or third session, he can pray.
A miracle.
Oh, mashallah.
Yeah, it's like, subhanAllah, it's magic.
Yeah.
That's really.
I remember how he cried in the clinic and how he was emotionally affected by what happened.
Because a lot of people told him like it's kind of severe, it cannot be treated.
Some people or some neurologists told him it's from your brain. Some of them told him maybe you have Parkinson's disease. Some of them, but no. It was only a simple thing.
And you were able to actually like diagnose it.
Alhamdulillah.
Diagnose it.
Yeah, in this moment, it's changed my life.
It's a life-changing treatment.
Yeah.
Yeah.
For me, it's for myself. Yeah, I felt like I was so happy. I feel like I'm doing something positive for the people.
That's something really worth a celebration.
Yeah, exactly. Yeah. So, alhamdulillah, he's good now, and he can pray. He can use his hands. He can. There is no shivering. There is no shaking in his hand. Nothing. He's very good. He's very well.
Comfortable.
Yeah. After that, I give him the treatment plan, how he do the stretching by himself in the home.
Yeah.
Now he's very normal person.
So doing stretches like at home could prevent from severe injuries like that in future?
You can provide yourself from the injuries when you use the stretching and when you use the correct way of your lifestyle.
Correct way of your lifestyle.
For your daily activity, physical therapy is with you in everything, in your lifestyle, in your walking, in your running, in your sitting, in your driving, in your working, in everything. So you have to take care of every move you are doing. Like if you are seeing yourself sitting in a bad way, you have to change it. If you are sleeping in a bad way, you have to change it. If you have something, you have pain, you have to start searching. We are in 2025.
Yeah, don't ignore it. Right?
Yeah, you can search the YouTube. Now there's ChatGPT. Anything you can use it to see the videos for stretching. So you can use stretching, you can use aerobics exercise, you can use anything at home. Even the Pilates, it's very good now.
Definitely, there's of course like a lot of things that we can use to prevent such injuries from happening, and there's definitely more to physical therapy. But after the break, stay tuned.
And we're back with Muhannad Bakir, who's going to be telling us all about one important question. I think for a lot of people, especially in physical care and chiropractical, is that the word? Chiropractic. Yeah. In those kind of fields, there's a lot of myths around it. And like, what are the most, common myths about your field, and how are you gonna, talk it through it?
The common myth is you're gonna break your bones if you're gonna do it.
Yeah, I think a lot of people are afraid. Yeah, they hear the crack and they're like,
exactly.
Is that the bones clicking?
Especially when they see like the videos of the neck,
Yeah.
That's kind of sensitive.
The worst thing that they see the video before they come to the clinic, because they're gonna know what's the movement you're gonna do. So I prefer they don't see the videos before they come, so I can do it immediately without thinking what's gonna happen.
Yeah,
he's predicting the movement. So I don't like that. But the most common myth is that when you use the chiropractic, when you use the manipulation, when you crack the bones, or you crack the body, it will you're gonna break the bones, or you're gonna get the paralysis.
Yes.
Yeah.
Most of the people, 90% of them, they think that they're gonna get paralyzed from the cracking.
Yeah,
it's not right. It's not correct at all. That's wrong. No, it's just adjustment. It's just putting things in the right way.
Yeah.
I was like that, like after one interview, after we done, and one of the doctors, like he came and he did it like the neck.
Yeah.
I was like, okay, am I gonna paralyze after this? But, but thankfully, no, it was really clear, it was fine, and I felt relieved.
Yeah, and you're gonna feel relieved because he is putting everything in the right way. Like I told you before, some of the things that you are doing in your life, it's wrong. So it make a small movement in your body, or make something is move a little bit, and it's not in the right way.
Yeah.
So when he do like this, you feel more relieved. You feel like out of stress also, and maybe some people think it's placebo effect, but it's no.
Yes.
It's a real feeling.
And I can imagine like working like that could be exhausting for you as yourself.
You can't imagine.
Like it demands a lot of physical energy, so how do you like do treatment for yourself and take care of your own body?
Actually, since you asked this question, working as a physiotherapist, like working for 5 years, it's like working for 30 years.
Wow.
Yeah. I'm really.
I can imagine.
Yeah, it's the truth, because it's very stress. You are in very stress. You are very exhausted,
and it's a high pressure kind of situation.
Yeah. Working for 1 hour can make you tired a lot. It makes you feel like you are exhausted. So imagine if you are working 8 hours or 9 hours per day. For every day, like for 5-6 years.
That's a lot.
For 5-6 days. I mean.
Yeah, that's a lot.
So yeah, it's a lot. It's more than a lot, So we try to do exercises.
Okay.
We do stretching. Actually, when I stop the gym, or I'm not exercising at the gym or building or strengthening the muscles, when I'm working at the clinic or when I'm working with a patient, I feel more tired.
Yeah, now, like you mentioned, like mashallah, you go to the gym as well. Like,
Yeah.
your work is like a gym already.
My work is like a gym, but you need to strengthen the muscle more with the weights, you know,
the weights.
so you can build muscle mass that will help you in your work, you know, because sometimes you have heavy people and
Mashallah.
yeah.
They're scary.
Yeah, they're scary. The bodybuilders, the huge guys with big height and the weights, you know. So, and you for them you're like tiny,
Yeah,
you know.
like- yeah.
So
Like fish to sharks. You know?
yeah, like that. So it needs a lot of power. I don't stop coffee. Coffee, it's all the day during my sessions. I don't stop coffee. I need something. I need a pre-workout.
Yes, the energy drink of today's life, coffee. Yeah, we can't go without it.
In terms of diet, like, do you have like specific diet that you are following, or wherever you feel hungry, just wherever is there?
Actually, when you are in a rush hour during the sessions, you eat anything. You need to something that give you the power and make you, you know.
Immediate and quick.
Yeah. But if you are relaxed and not rush hour and you have your normal numbers of patient in the clinic, I think it's okay. You're gonna strict your diet and you're gonna eat healthy food.
Yeah.
But sometimes you need chocolate, you need something sweet like this to
Snacks,
eat.
yeah.
To give you the same power, you know. You want it.
Exactly.
So would you say physical health is important to you, you know, in your field? Because I know for a lot of patients, especially like someone like myself, who if I got a sport-related injury and I go to the doctor and I see the doctor is fit, I feel more confident. So would you say physical health is as important as the actual experience?
Yeah, too much.
Yeah.
Because I told you, it's physical therapy is not only the treatment; it's also a protection.
Yeah.
Yeah, so you can use it before you have the injury or you have the spasm or have the feeling of pain.
Yeah.
So it's like a protection. So you can do it like a lifestyle, maybe one in a month, twice in a month, 1 in 6 months. You know, you can do it like that, but you have to do it. Eventually, you have to do it because it's like a protection, and that will increase your health, to increase your physical health.
Yeah.
You
Yeah,
know?
like I'm seeing as insurance,
Yeah, for sure. Yeah,
like body insurance.
yeah, that's for sure.
Yeah. So I was just going to ask, from working with so many patients, what is the most common type of injury that you've seen, or the body part that has more pain in it?
We are talking in Kuwait.
Yeah.
Well,
generally.
it's kind of specific.
yeah.
Really?
Oh, it's different. We can go for both ways. Like, what's the difference between locally and other patients?
Okay, the most popular injury
Yeah.
is in Kuwait here, especially it's in the Gulf countries.
Yeah.
It's called they call it by Arabic the abhar.
Abhar.
Yeah, I know. They call it the abhar. Abhar, it's like we call it in our study. It's we call it the rhomboids muscles.
Rhomboids.
Yeah, it's the muscles between the shoulder blade and the spinal cord.
Okay.
Okay. Yeah, at this point exactly, 90% of Kuwait are suffering from this pain.
Oh, that's new to me.
Yeah,
Maybe after the session we should check you.
you know why?
Yeah. Is it from sitting?
You know why?
Why?
Because the most common from two things: sitting of the car, okay.
Okay.
But the most popular, the diwaniya.
Duani.
Really?
Yeah.
It's like the setting of the diwani.
Because
like,
they are sitting, focusing in one hand.
You mean like the ground setting,
Yeah.
right? Not like the
No,
carpet chair.
no, not the chairs.
ground one.
Some people, when they are suffering from this abhar, I tell them you have to change the sit in the diwani. You have to put chairs, you know, because sitting in the ground, he will
Okay, lean
one
on
hand,
side.
Yeah.
and he will focus.
Takaya, as we say it in
takaya,
Arabic.
yeah,
Yeah.
exactly.
Yeah.
He will focus in one elbow, so he's gonna stress the whole muscle for many hours, you know, and he can't. He's not with the time. He's playing anything. He's doing anything.
cards,
He's talking, yeah, cards. He's talking with his friends. He's watching a movie. So time by time, one time. After that, with the car, with the holding the phone, it will increase. So this is the most famous injury.
Oh, that's why you said the Gulf states, because Duani is very
Because
common.
Duania is common
Yeah.
in Gulf countries, you know.
Guys, tomorrow is Thursday, and I know a lot of you is going to Duania, so maybe it's a good time to visit like a physical therapist, so you can check and prevent such injuries from happening in the future.
And what about outside? Because you said it's a different answer.
If we're gonna talk about worldwide,
Yeah.
we're gonna talk about lower back, shoulder pain,
Okay.
and knees.
Okay.
This is the most common. Actually,
So if I have all of those pains, I should go seek a.
you're gonna have to see a chiropractor.
Yeah.
He gonna fix you for sure.
Yeah.
We can fix it. Yeah.
Of course, yeah.
Yeah.
And after sitting like 4 hours in this show, you know, we definitely need to
Oh,
see.
4 hours. Definitely you need.
Especially after what he said about Douanier, because I was in Douanier last night for 6 hours in the
Oh
same
my
place.
God.
Yeah, playing
the
cards.
Tekaya.
In the Tekaya, yeah.
Yeah, that's horrible.
Yeah. And so speaking of is it rhomboids?
Rhomboids. muscle,
Rhomboids.
yeah.
So how would the treatment go? Is it
Actually, we do manipulation, the cracking. Generally, we can say so. The cracking of the shoulder blade and the cracking of the shoulder will relieve the area. After that, we can use electro.
Yeah, I saw like a video where there's like some needles and
This is in the severe cases.
Severe cases.
Yeah, in the severe cases, we always use dry needles, and we put electro for them. You know why? Because we want the electrical stimulation to get deeper in the muscle.
okay.
Yeah, because already the needles is inside of you, inside the muscles. So when you put the electro in it, you're gonna make the electrostimulation get deeper to the muscles inside.
Oh.
You know, so it will be more relieved.
Interesting.
We can use also the ultrasound, the shockwave, as I told you, and we told him to change your lifestyle. Change your lifestyle, change your settings. You can use a tennis ball and stress it.
Yeah, I see that.
Yeah, that
Some
video.
athletes they do it.
Yeah, because you want you want a quick solution
Yes.
by yourself, so you can use a tennis ball.
Yeah. And it's great that you said, adjust your lifestyle, because a lot of people underestimate the importance of changing just small things about their lifestyle and how much impact it can have.
For example,
Like, for example, I know for someone that says that if you play a lot of video games, every 20 minutes or 30 minutes, just look away. And it's such a small thing, but it has so
Correct.
many great effects on your eyes.
Correct.
So as sitting, and so as playing and driving, and
yeah, correct. It's like, for example, when I have a patient, they are suffering from lower back pain. I tell him, what are you working? He told me, I'm office guy, so I'm sitting for 8 hours in the same chair.
Yeah.
That's very wrong. So I tell him you have to change your posture every 45 minutes. If you are sitting for 45 minutes, you're gonna stand for 2 to 3 minutes, and the opposite. If you're gonna stand for 40 or 1 hour, for 40 minutes or 1 hour, you have to sit for 5 minutes.
Yeah.
You have to change your position every 45 minutes or to 1 hour at least. It's the same for the video games or using the phone. You can't use your cell phone for 1 hour or 2 hours like this.
Yeah.
Surely you're gonna have a hard neck pain.
Definitely.
It will be sore here all the way, and the muscle will gonna get spasmed, and you're gonna feel pain all the day. And after that, you're gonna complain to us that I have a lot of pain. It's because using the cell phone for 2-3 hours or playing video games. The new generation is.
Yeah, with like all electronics devices and everything.
Yeah, with the PlayStation and other things, doing too much activities with all electronics. Before, if you see before, our grandpa and grandma, they don't have the same pain. They don't have a lot of pain in their back. Mashallah, they get 80s, 90s, and they don't have any problems or issues because the lifestyle was very good. Not like this, not like today. Today, all video games, cell phones, and other things.
Exactly. And I think Abdallah, after sitting, for like how long? 45 minutes. Maybe we should do some.
We should finish this interview while standing.
Yeah.
To send a better message to the
So we
audience.
can change our position.
Yeah.
Definitely. Thank you so much, Muhannad
You're welcome.
Bakir.
Thank you for
physical
having me
therapist,
today.
for being with us. We really enjoyed your conversation, and it was very enlightening, actually.
Thank you.
Thank you for
Thank you
being
for
with us.
having me today,
Thank you.
guys. See you more.
Yeah, definitely. And as I told you, tomorrow is Thursday, so you need to walk, so you need to change your setting, so you can have a better lifespan,
Yeah.
and as well as
Yeah,
without any
that's
injuries,
true.
inshallah.
Yeah.
So we're gonna take a quick break and then be back. Stay tuned.
Unfortunately, that was all of the time we've had on The Untold. This was another great episode, talking about the body, the health, and basically, going through what you need to do to have better physical, improvement.
Exactly. As you take your car for services, like from time to time, you need also to take care of your body, because this is the vehicle that takes you through life. If you don't take care of your body, then whenever there's a challenge, they're gonna prevent you from even pursuing further in life. And the more we age, the more our body become kind of weaker. So we need to strengthen our muscles, take care of them at young age, so they can serve us in future period of life.
Yeah, and I think one of the highlights of today's episode is that Muhannad Bakir talked about a patient who was in his 60s, right? And he couldn't pray, and then he went for him for, treatment, and then he, through physical therapy, he got him to in a better condition. And I think that was a really great, insightful little bit of tidbit for today's episode.
Definitely. And with that, we reach the conclusion of our show for today. Until next time, take care of your body. Try to visit a physical therapy from time to time so you can check and make sure everything is correct, and stay safe. See you later.
See you later.